How to design an emergency care system. Developing an understanding of emergency care may seem like a daunting task, especially if, like in Bangladesh, there is no working system in place. However, there is a framework developed by the World Health Organizations that makes it easy to understand how to design an emergency patient care system. Policymakers in low and middle income countries who wish to strengthen their national emergency care system can start and implement that framework. WHO Emergency Care System Framework divides the initial journey of acutely ill and injured persons into three locations. The first is the scene how the illness or injury originates. The second is the transport of the patients. And the third is the facility at which the patients undergoes treatments. It also classifies all the actions taken from the scene of illness and injury to the treat of the facility in three segments: human resources, functions, equipment, supply and information technologies. All the three locations are interconnected by effective and prompt actions. Not only are lives saved, but the overall quality of life after the illness or injury is much improved. The most sensible aspect of this framework is that most, if not all, of the elements are already present in health economics. Let's look at the framework in the country of Bangladesh. The action plan of any particular case of emergency care may vary as it depends on the patients and their illness. It will also be depending on the scene of illness or injury, urban or rural, indoors or outdoors. The only constant in all these situations is the heightened state of emotions that the patients and their close ones experience, and the anxiety that stems from uncertainty. The response of a bystander, if there is any, is crucial in this situation. Or there is having basic first and skills or even just the ability to call for help. Bystander is key to providing the initial help to the patients. Bystander response can be substantially improved in Bangladesh by means of one of many successful public health companies that have already been run, or it be by the media or formal educations. Furthermore, the country already has a national emergency helpline 999, which is accessible free of charge. Training these dispatches in emergency care and efficient methods of communication can help both the bystander and the patients. Transport is critical factors when it comes to Bangladesh. Firstly, the current state of urban traffic is a huge barrier to providing emergency healthcare due to road congestion. The sense of responsibility to facilitate the passage of an ambulance to any given time must be instilled within the community. A combination of better traffic flow and improved policies is undoubtedly needed for this, but it will take time. However, what is more easily achievable is upgrading the ambulance services. Instead of using ambulance as a means of transport, train first responders and appropriate equipment should be added to the services. At the same time, the authorities concerned can develop a national ambulance service, which should take a relatively short period of time. There's a shortage of facilities that house an emergency department in Bangladesh. The High Court has ordered all healthcare facilities and providers in the country to provide emergency care to patients. But what needs to be looked into is the quality of the emergency care and standardize all these facilities so that patients don't waste time deciding which facility to go. The fact that most of the health economy in Bangladesh runs on an out-of-pocket scheme should not affect this stage of care, as care must be provided before payment. With proper training of all healthcare professionals and planning for infrastructure and resources, patients can be efficiently treated in this emergency units and appropriate deposition plans can be made. Effective communication is vital in this entire process. Although it is a dispatcher responsibility responding to a bystander alerting the nearby facility or the first responder providing a clinical handover to the receiving unit. There should be clear communications with the patients and the attendants as well. There is no doubt that Bangladesh has all the required elements to design an effective emergency care system. What is needed in the alignment of these elements? Responsibility to ensure that critical patients survive and make good recovery is not only for all the healthcare sector but all the relevant government sectors as well. This is definitely a challenge, but it is a challenge that Bangladesh affairs to be ready to take. Dr. Mir Salahuddin Ahmed, the content